I thought I'd start with just an update on the current status of health reform. So much is in the on the nightly news and in the paper and stuff like that, and there's a lot of flux. I'm going to present as of today what's going on, but I first wanted to give a backdrop, and I need to give a disclaimer. Our health system is neither politically right nor left. And what I share with you is simply facts as I see them. But the current Affordable Care Act, sometimes simply the acronym of the ACA, many have been critical and many have praised the Affordable Care Act. Those that praise it call out the pros that millions of uninsured now have insurance, particularly through the Medicaid expansion. In California, 1/3 of all adults have health insurance through Medicaid. We call it Medi-Cal. And 50% of children in California are insured through Medi-Cal. I'll just continue going into the pros. The electronic health record has been a boon in order to keep records secure and also make them available to other health systems. Preventive health has been an emphasis. Covered California, which is the healthcare exchange in California, has made it easier to access and have affordable premiums. From the Hospital Association standpoint, again, we're not political either way. Our belief is that when the Affordable Care Act was first passed, it was largely done swiftly for political reasons, and we could have done a better job in planning for things. Now, equally, there is an equal opposition, and it's now political to repeal and replace it with something without real secure planning. It would amend the Affordable Care Act effective January 1st, 2018 by eliminating funding. So it doesn't remove the act, it just takes away all the funding for it. So in essence, it is no longer viable. It increases funding to community health centers. For example, we have Clínicas de Camino Real with us tonight. It would increase health centers. It also would increase funding for maternity and newborn care in 2020 and beyond. It would provide age-based tax credits for those earning $75,000 or less as an individual, or $150,000 with joint filers. It would eliminate federal funding of Planned Parenthood and other similar organizations for 1 year. This is both praised and censored in the media.
Thank you very much for allowing me to speak to this evening. You know, I'm a little frustrated because I told them that I had a lot to talk about. I needed 2 to 3 hours, and they've only allotted me 20 minutes. So I'm going to give you an overview, try to have you understand the excitement that I feel and that we all feel at Community Memorial Health System, let you know what's happening. So hold on. I'm going to touch on a number of topics, and the things that I want to most communicate are: one, what our specialty services are, the things that are life-saving, critical services, just part of the many services that we provide. We'll go over the outreach services, such as our Health Aware and our lab and where we're located, the residency training program, which for me is one of the most exciting components, and I'll explain why this is so important to you. Our community-wide electronic health record, and as Gary mentioned, there are ups and downs with that electronic health record. I currently use that record, and I will tell you, I think the benefits far, far outweigh in our current health system and health environment far more than the negatives. And finally, I'll describe briefly some of our partnerships which allow us to provide the robust care to our community, you all. First of all, a lot of people don't understand, because we hear so much about the large medical centers, that 87% of all the hospitals in the country are community hospitals. Community hospitals are the backbone of the care provided to all of our communities. Now, we really provide the bread and butter kind of care. In fact, we have UCLA training physicians coming up to Community Memorial Hospital to learn how to do gynecology and gynecologic surgery because we have more day-to-day type of operations than UCLA has. And so they're very grateful for that. Now, don't get me wrong. If you need a liver transplant or a heart transplant or have an exotic type of rare illness or problem or cancer, we definitely refer our patients to UCLA or Cedars-Sinai or USC or any one of the tertiary care centers. But those referrals are few and far between. We also have our new Parent Resource Center, which new mothers are often in hard pressed to figure out what to do with their baby. And our resource center helps them walk through all the steps on how to cope. And it's such peace of mind to our new parents. I will tell you, this is truly a wonderful thing. We have our Health Aware program. In fact, this month is May. It's Stroke Awareness Month. And so last night, I went on and I took the stroke assessment test. It takes you about 7 or 8 minutes to take. I would recommend you go online to cmhshealth.org and take the test in which you think you might benefit. Heck, take them all. If you are deemed by the results of the test as being high risk, you can make a call to the number provided and you will be further assessed by a specialty care nurse who can then recommend further testing, labs, possibly other tests, and then refer you to the right source, your own family doctor, if that be the case. So this is an exciting opportunity for outreach as well.
A building update quickly. This is just an aerial view. This is the new hospital right here. This is the current hospital. This is a picture that was recently taken of the front of the new hospital. Notice this mosaic I'm going to show, but this is a view from the new parking structure where you'd walk right across the street into the new building. This is a more close-up view of this mosaic Millard sheets that we relocated from. It was a legacy mosaic that we had for decades. We had it in a courtyard. We brought it up and over, and we're mounting in front. We're covering it with a UV protection, and below here is going to be a pond with a waterfall on the back to add a sense of nature with the sound of falling water and so forth. It'll be very beautiful. The UV protection also gives it a scrubbable value aspect so that if there is a graffiti artist, we'll be able to scrub it off, and they'll get their feet wet because they'll be standing in a pond. So this is just another view of the NICU, another view of that. This is an electrophysiology lab. Dr. Stan talked about this earlier. This is where the EP procedures like ablations would take place. This is one of the smaller operating rooms we have with the booms. We call them booms, or the suspended air systems and so forth. All the computers go and all the lights. The lights are the most state-of-the-art. This is the first hospital where they've been installed. There are about 300 individual lights on it, very, very bright. And each light has a camera on it. And it's connected to what we call our image stream system. Because we're a teaching hospital, surgeons can actually see a surgical procedure in an adjoining room and watch a surgical procedure going on while it's happening.
Thank you, Gary. My part is really kind of brief, which is cool for me and even better for you. It was within the last 10 years that our Board of Trustees were investigating what to do about the California seismic requirements for California hospitals. They thought about adding on to the current facility, or perhaps just renovating the current facility and bringing it up to the seismic requirements as they exist today.
Well, you've been delightful, and Stan and I and Bill will be up here to answer the questions you have. Thank you so much for your interest. You've been a great audience. Thank you.